నమస్తే వెల్కమ్ టు టీసాట్ స్పెషల్ లైవ్ షో. ఈ రోజు మనం గురుకుల్లో భాగంగా నర్సింగ్ స్టాఫ్ నర్సింగ్ సంబంధించి మైక్రోబయాలజీ మైక్రో ఆర్గానిజం గురించి తెలుసుకుందాం. మరి వీటి గురించి మరింత ఇన్ఫర్మేషన్ మీకు ఇవ్వడానికి మనతో ఉన్నారు ఓ విద్యాశ్రీ గారు, సబ్జెక్ట్ ఎక్స్పర్ట్. పరిచయం చేసుకుందాం. నమస్తే అండి.
నమస్కారం అండి.
సో వాట్ ఈస్ మైక్రో ఆర్గానిజం అండ్ మైక్రోబయాలజీ?
Yeah, microorganisms basically it is both living things and which are individually made up of, and they are small and it cannot be seen by naked eye. So all these are maybe following due to considered of microorganisms. So bacteria, fungi, protozoa and microscopic algae, viruses and various parasitic organisms. Whereas microbiology vachesi it is a study of microorganisms and which we call it as, and this is the foundation of modern biotechnology. And among that, if you see many specialized fields of there in microbiology, like virology antamu, mycology antamu, bacteriology antamu, immunology, and then microbial ecology and biotechnological microbiology and environmental microbiology, food microbiology, forensic microbiology and molecular microbiology. These are the very commonest like specializations in the microbiology of the study of the microorganisms which are considered. So in that, if you see microorganisms and microbiology, there are two main themes and in this involved in the microbiology. One is basic cellular process antamu, and then is applied concentrating on agriculture and industry and health. So basically right now we are using in our agriculture process and industries, and for the health, how to maintain it, we will read about microbiology, which type of microorganisms are being helpful and which are the microorganisms which are harming to the human body and even into the agriculture and even into the industry. And the basic which is it is a cellular process. It is basically in the cell structure, maintenance and all these things, or how the type of microorganisms are involved into that, those things will be identified in this microorganism and microbiology.
Okay, what are the themes in microbiology?
In the themes of microbiology, if you see, there is a basic and applied, as I said. And in basic, if you see, it is a by microorganism and by process. So by microorganisms, vachesi by bacteria, which is called bacteriology, and like phycology, virology, myology, and parasitology and protozoology. Whereas by process, vachesi microbial metabolism, microbial synthesis, and microbial genetics. What is this? And in basic, disease related, like immunology antamu, epidemiology antamu, and etiology antamu. So these are the three basic structures what we have in themes of microbiology. And in applied, if you see, that is disease related, mainly on the infection and control, chemotherapy, and environmental microbiology related to environment, and industrial like food and beverages, technological and pharmaceutical microbiology, and genetic engineering also will be leaded into this. Genetic is basically on the gene structure, and if you see, we are developed into India a lot of because of the genetical microbiology and genetical engineering. So that is what about themes. If you see about the microorganism, how too small it is looking, and they are germ rapidly growing cells, what you see, and there has habitat, it is where they can live, they will be living on. So live in the population it is there, and it communities and either swimming freely it will be there. So interact between both the communities, maybe in the harmful or beneficial. So there are two type of microorganisms. So microorganism anangane it is harmful and okati untundi, but even it is beneficial also. So because of beneficial, see, cooperative feeding efforts, waste and the nutrients, so these are the very commonest which are beneficial for us. And during harmful, they are because of the waste products what is generated by human cell or by agriculture or anywhere in the our society and our environment especially.
Okay. So how the microbes are affecting in lives?
So microbes is generally they affect in the life in health process. So generally, if you see, lot of microbes are pathogenic, like disease causing agents antam manam pathogenic anappudu. So this disease causing agents will be there in this lives, and which are decomposed organic waste lo untundi, like any produces through the photosynthesis process antam, that is like purple sulfur bacteria must fix to carbon dioxide to alive. So this is one of other thing, and play a role in industry like fermentation antamu to produce ethanol and acetone, and produce fermented food, vinegar, cheese and bread, and produce products like manufacturing cellulose and the treatment of insulin. So these are very effects in our life. If you see in general, food like lactocoli and ferment milk. So now food like milk will be converted into curd, that is because of the lactocoli. So that is one other thing, and the waste materials or waste treatments or anything is generated, we will see it. And then water treatment is more commonly is affected to this, and energy produced like methane, and like science laboratories also develops a lot of microorganisms, microbes which are in life. Warfarin like anthrax, we will tell, this is also a type of which will be used in our life. And basically if you see in our life how it is occurring anedi, microbes and agriculture is a very important for us. So in that is nitrogen fixation, what we call it as. So by seeing this, if we can easily identify this, nitrification will be occurred in such a process that nitrogen fixation will be there, and nitrous oxide will be developed and nitrobacter will be there. So through this what happens is, like any microbes like digest grass and high in cows, sheep or etc. will start cycling the nutrients like carbon, nitrogen and sulfur, and which will causes the diseases to animals and plants also. So the nitrogen fixation is also very important for agriculture in the main feature. So that is another thing. And in microorganisms in food, if you see, so like prevent spoilage, like anything we add it like preservatives, we call it as in day to day life, like salted fish we will tell, and these are general things what we do it, but we don't know what exactly which one is occurring in our lives. So that one, and assisted like in manufacturing of food materials, and like microorganisms and energy like natural gas like methane antamu, ethanol antam, biofuel and remediation antamu. So these are also which will give us energy by generating energy. And some other microbes are future, if you see, it's called genetic engineering, that will be, we are expecting for the future for the genetic engineering much more. And if you see microbes and these diseases, you will see lot of, if you see in this picture, each of the agent and organism which is called E. coli antamu, HIV, AIDS, virus, heparis. And then if you see ulcer, malaria, there are so many diseases which are causing. This is an example of the pictures. If you can see, these microbes will be affecting to the diseases and matter. So that is what about the microorganisms which are in the life and the lives.
So classifying microbiology.
Yeah, microbiology is in detail classified like very like it is a Linnaeus system for scientific nomenclature andi. Each organism has two names, like genus antam okati, generic name, and specific epithet antam. So these are the two names which are having to the microorganisms. So scientific names వచ్చేసి different area, region, origin బట్టి ఉంటుంది. దాంట్లో వచ్చేసి if you see a Latin origin అంటాం. Example వచ్చేసి is Exerina coli అంటాం, E. coli అంటాం మనం. ఇది it is from the discoverer, it is Theodore Isaac, but most of the describes the habitat, it will be present in the intestines. So when this Exerina E. coli is present in the intestines, if you see, so lot of the any intestinal problems will be there, which will be bacterial effect. So those can be estimated that it can be to the Escherichia coli. So that is one example of that. And another scientific name, if you take Staphylococcus aureus, it is also very commonest thing, that is called on skin. You can see a lot of these things like clustered staphylo, spherical untundi. Clustered means a different type of cluster, like a grapes, how it will be like a cluster, it looks like that. And spherical is a round shaped antamu, and gold colored colonies antamu, aureus. So these are the way how we can differentiate the Staphylococcus aureus. So these are called as scientific names. Some of the examples are that. So basically in detail into this classification, if we go to the microbiology, so there are different things andi. In that is classification of bacteria. So bacteria vachesi domain lo bacteria, archaea, eukarya. So these are three types. If you see, bacteria and archaea are very common in like microorganisms, like are included with fungi, protozoa, algae and viruses and multicellular animal parasites. But whereas eukarya is in plants, animals and fungi and protists. So this is very common. If you see, this is bacteria is a type of prokaryotic cells, and these will have binary fusion, that is dual fusion, and then utilizes the inorganic chemicals or photosynthesis to obtain some energy. So whereas archaea is also a prokaryotic, but even it releases methanogenesis, and it makes an extreme thermophile. So that is the difference between the bacterium and the archaea. And whereas types of eukaryotics, if you see, protozoa antamu, algae antamu. So protozoa is unicellular eukaryotic cell andi. So this single cell, unicellular is called a single cell which has been present in the eukaryotic cell, whereas it absorbs or ingests the organic chemicals, where most commonly we will give as amoeba is a best example for protozoa, whereas algae also can be a single celled organism or a multicellular organisms which are called as eukaryotes, and cellulose and cell walls will be present, and in this also there is lot of like energy can be generated only through the photosynthesis process, and it produces through the molecular and organic compounds andi. So fungi, another one, it is a singular fungus, what you say, it is a eukaryotic cell andi. So in this cell walls, if you see, there is lot of organic chemicals which are forms the energy. So molds, mushrooms antamu, these are all multicellular things consisting where we are taking it in our daily life as a food. So yeast are unicellular. So some which are called, they are developed into a healthy for us for our diet, but some are very harmful, those are called microorganisms. సో లైక్ వైరసెస్ ఉన్నాయి ఇందులో, మనం బ్యాక్టీరియా చదువుకున్నాం ఇప్పుడు, ప్లస్ ఇది ఫంగై అన్నాము, తర్వాత వైరసెస్ చూస్తే సో ఇది వెరీ స్మాల్ అనమాట. వైరస్ ఇస్ వెరీ స్మాల్ వన్ విచ్ కెన్ బి ఓన్లీ అబ్జర్వ్ త్రూ ద లైట్ మైక్రోస్కోప్, నాట్ అదర్ దాన్. సో ఇందులో డిఎన్ఏ ఆర్ఎన్ఏ రెండు కోర్స్ ఉంటాయి. సో ఇట్స్ వెరీ స్ట్రాంగ్లీ బిల్డ్ అనమాట వైరస్ అనేసరికి. దట్స్ ద రీజన్ వీ సే వైరల్ ఇన్ఫెక్షన్స్ ఆర్ వెరీ డేంజరస్ యాక్చువల్గా. సో కోర్ ఇస్ surrounded by a protein coat. Protein coat is helping out for strong and strength. So and this also has a lipid envelope also, and this virus is completely replicated with the if you see bacteriophage viruses are infected with bacteria or viruses which are nucleic acid with protein coating. So ee vidhanga this virus will look in such a way, if you see the shape is been looking like that. So most of the common example for the virus is human immunodeficiency virus, which we called as is a HIV, which you know that there was a medicine was not properly done till now, but recently we have got some medicine which can be controlled to HIV. So this comes under this family, the virus is coming under with this family. So they have to understand what is the virus, how it looks, and what are the structure of the virus, and which diseases it will cause, and what type of that. So multicellular animal, this is called helminths అంటాం. మీరు బాగా వినే ఉంటారు, లైక్ వామ్ ఇన్ఫెస్టేషన్స్ అంటాం పిల్లలకి కానీ at the age of 1 to 5 years అంటాము. తర్వాత elders also, because of the environment changes also they will have. So at least they should see what is the abnormality in this. So these multicellular parasites like helminths antam. So these are very commonest things in that. The structure looks like this in this picture. It's like this is like a round bomb. So if you see how to visualize a microorganism ante, there is units how to you have to check it out. Especially microorganisms can be checked because they are micro ante small. Yeah. So that can be checked only in the microscope. So it is 1 micrometer వచ్చేసి 1 into 10 to the power of -6 meters ఉంటుంది, or by 1 into 10 to the power of -3 millimeters అని ఉంటుంది. So this also sometimes they may ask in the questions when they are preparing for the exam. సో మైక్రోమీటర్లో మనం కొలుస్తాం అనేది ఇంపార్టెంట్, అండ్ నానోమీటర్లో కూడా. సో 1 millimeter is equal to 1 into 10 to the power of 3 nanometers. So this is very commonly given, and మనం చూస్తే a human hair is about 100 micrometers wide, and a red blood cell which we will see around 8 micrometers wide ఉంటుంది. So whereas typical size of an animal cell will be around 10 to 100 micrometers ఉంటుంది. So these are the basic normal some of the examples how exactly these microorganisms will look like. Okay. So basically we will see in the microscope. So that is light microscope, what we call it as. Parts వచ్చేసి uses light microscope లో few types of microscope if you see, like it is a compound light, whereas microscopic dark field అంటాము, phase of contract, differential and fluorescence అంటాము, డై వేస్తే ఫ్లూరెసెన్స్ అంటాము. కాన్ఫోకల్ అంటే 2 type of cells will be there. బైకాన్కేవల్ లెన్స్ యూస్ చేసినప్పుడు మనం అలా. సో హౌ ఈజీలీ వీ కెన్, విచ్ ఆర్గానిజం ఈజ్ నాట్ విజువలైజ్డ్ ప్రాపర్లీ ఫ్రమ్ మైక్రోఆర్గానిజమ్స్. సో దీస్ ఆర్ ద డిఫరెంట్ టైప్ ఆఫ్ మైక్రోఆర్గానిజమ్స్ కెన్ బి యూస్ టు ఐడెంటిఫై విచ్ ఆర్గానిజం ఇట్ ఈస్. For example, if you see in this microscope structure, this is the way the microscope looks. Base and the light focus ikkada untundi, stage clips untundi, so that slide can be kept here, and the organisms can be collected by the form of any type of swab culture or anything, and can be kept on that, and then it can be visualized. And this is the ocular, we can see from the eyepiece, and this is the body tube. So this is the different sizes of the microscope which you can see.
Okay. So how to analyze microorganisms?
Yeah. Analyzing microorganisms, we can just see by microscopes, by compound like microscope and all. So magnification is very important in that, and analyzing which type of microorganism it is. So our microscope will also concept 3 magnifications untai. Okati scanning, low and high low ఉంటుంది. So scanning వచ్చేసి around magnification will be 4x అండి, ocular lens వచ్చి 10x, total magnification will be 40x will be there, and low power will be the 10x magnification, ocular lens వచ్చి 10x and 100x is called total magnification. High power లో మనం చెక్ చేస్తున్నాము అన్నప్పుడు 40x and 10x and 400x is complete our total magnification, and these can be identified, and this can be seen by and can be adjusted by through the microscope. So this is what about the microscope, but in brief, to identify how we have to analyze a microorganism, so this study of a small history is there around microscopy. So the Aristotle is the first person who has identified these microorganisms which are there in the living organisms. Later lot of sciences, like as you are seeing in 1590 Hans Jacobson Janssen is produced a compound microscope and 1660 lo Robert Hooke, and then in 1676 Anton van Leeuwenhoek, and in 83 Carl Zeiss and Engelbert, and in 1931 Ernst Ruska. So these are the first electronic microscope he has checked out. So this is also a history of microbiology, can be asked in any question regarding who has identified the electron microscope. So if you see, these are the different types of description of the bacteria, how they have given in each microscope which is looking. So this is all coming under analyzing andi. So analyzing part, we should know what is the difference between each microscope and how the adjustments of microscope, magnification, and then we should understand which is the structure of bacteria, virus, parasites, fungi. If we don't know the structure, we can't identify which organism is what. So that is one. And there are spontaneous generation of controversies, theories which have been also developed in this one. In 1688, if you see Francesco Redi, which he is an Italian physician, he identified saying that there are a lot of rotting in meat, there are a lot of producing magnotes, so which are also a type of microorganisms. And in 1936, Theodore Square, so he also identified a functional unit of the cell is in the living organisms, because these all people identified, these are the examples of how to analyze a microorganisms. And in 1861, Louis Pasteur also developed this type of experiments. Swan-necked flask will be there in the microorganisms which will be spontaneously generated in the cells. So this is around 50 years, about 50 years of this golden age of microbiology. These are all this like scientists have been developed, and they have identified these type of things are being present in that. So these are the proof that microbes will cause the disease, especially anedi. In 1546, Hieronymus Fractorius, he has seen that it is a phenomenon of contagious infections will be occurred. And in the same way, the germ theory diseases in 1857 and 1867, Joseph Lister also has antiseptics in surgery, how to use, he has identified. And 1876, Robert Koch, who is a German bacteriologist, he has cultivated the anthrax for the bacteria and by using it. So if they would have been not done, so we would have not identified what is the organism also till now.
Okay.
So, and that is the Koch's postulates is one of the very important thing, and which everyone should know it in generally and even in the medical field. Like Robert Koch, he demonstrated first bacterium in disease. So this is called as 1884 the critical test for the involvement of microorganism in a disease, and even it is very important in the examination point of view also for them. So this will be causing this will be identified. It's a development of pure culture techniques, stains, agar and cultural medium antamu. So it will be there on the causing disease like any type of like mostly of the tuberculosis, what we call it as. So when we are analyzing in detail, this preparing of smears of food staining అనేది very important part అండి. సో ఒక కల్చర్ని మనం తీసుకునేటప్పుడు ఎంత అసెప్టిక్ టెక్నిక్లో తీసుకోవాలో ఆ స్టెయినింగ్ కూడా కరెక్ట్గా చేస్తేనే విచ్ టైప్ ఆఫ్ ఆర్గానిజం అనేది కరెక్ట్గా తెలుస్తుంది. సో స్టెయినింగ్లో వచ్చేసి కలరింగ్ అంటాము, కలరింగ్ ఆఫ్ ద మైక్రోబ్ విత్ డై అంటాము, లైక్ దిస్ ఆర్ సర్టన్ స్ట్రక్చర్స్. సో స్మియర్ అనేది థిన్ ఫ్లేమ్ ఆఫ్ ద మైక్రోబ్ ఉంటుంది, సొల్యూషన్ ఆన్ స్లైడ్. సో ఈ స్మియర్ ఇస్ యూజువల్లీ ఫిక్స్డ్ టు అటాచ్ ద మైక్రోబ్స్ టు ద స్లైడ్ అండ్ టు కిల్ ద microbes. So these are two smears of for staining. So if you see staining lo vachesi stain usually consists of positive and negative ions. So basic dye vachesi chromophore antam, it's a cation, and acidic dye vachesi chromophore is an anion. So these two, if you see in this picture clearly, they are able to stain it. So when they are staining, if you see, you can see the microorganism very clearly under the microscope. The adjacent to that we will not be able to see. So staining of the background instead of the cell, you will see the called as negative staining. So this way of staining will easily identify for us. Simple stain untundi and differential stain will be there, and germ stain is there, and acid fast stain is there. So these are the stains which are 4 types which can be seen into check for the which type of bacteria is there. Special stain అంటాము, దీంట్లో distinguish small parts like cells, capsule, ప్రతి చిన్నది కూడా we can identify easily. So you are seeing these pictures is clearly mentioned which are this one. These blue dots are the microorganisms. So in this, if you see this pink color here also, so it is identifying, it is elevating. You can see that these are the microorganisms which are present. By seeing the cell structure, we can identify which type of organism is affecting to which disease. That's the reason we are able to tell which type of disease it is. So like gram stain, if you see this gram positive bacteria antamu, gram negative bacteria untundi. So these are more common for the like positive bacteria for penicillin and other things, and negative is for resistant to antibiotic. So these bacteria will look like this in gram staining. So there's a difference between this picture and this picture. So there is a rod-like structures which are called as gram staining, we can see. So with this we can identify which type of disease is occurring. So these are the way to analyze completely of the microorganism. If you go in detail, it is more in this. Each disease prakaramga kuda manam vellochu.
Okay.
So like that.
So role of nursing in infection control.
So role of nurse is very, very important in infection control andi. Basic infection control will come through the maintenance of the hospital and treating the nosocomial infections. So if you see exactly the main nosocomial infections can be, the very fast requirement in a hospital is that it should do the sick no harm. So people comes from outer area to environment to the hospital environment when they are already into certain disease condition. So they should not get more sick, or harm to them should not be happened in the hospital area or hospital region premises. So that is the main motto of that. So what is infection andi? So what is infection is, it is injurious contamination of the body or parts of the body by bacteria, virus kani, fungus kani, fungi kani, protozoa and rickettsia, or by the toxin that they produce from that. So in that, infection may be also local or generalized untundi. It can spread throughout the body, and even it also helps one of the infectious agents we can identify to the any host antam. Manam human body is called as host, so which produces the infection symptoms like pain kani, swelling kani, redness kani, and functional disorders, general daily function disorders, or raise in temperature and pulse rate, and leukocytes antam. So these type of things, if anything is present in the patient, it is called, they are affected with nosocomial infections anandam. So these are the signs for getting infection which they have to identify. So risk will be there for infections. Infection is always present in the hospital. So but we can't say that 100% they will not get infection, because lot of infections patients will be there because of another conditions also. So it may acquire infection before admission to the hospital. Either they are community acquired before admission to the hospital, or to the community acquired infection can occur. And patient may also get affected inside the hospital sometimes. That is because of the nosocomial infection. So these are the two things which will be affecting to this one, and it includes the infections which are called as not presenting nor incubating at admission. At time of admission, it may not be there to the hospital, and infections that appear more than 48 hours after admission. So first admission they will not have, but after 48 hours in the hospital, they'll start getting infections. And those acquired in the hospital but appear after discharge. Some people will not be shown at the hospital place, but after discharge of the treatment, when they go to home for other this one recovery, they will be appeared at the home back again. So that time they have to come back again for the taking care of an infection. And occupational infections, most of any occupation you take, any occupation, we will be thorough to get some or the other infections, because microorganisms or anything we will be not been seen very with our eyes. It can be only seen with the microscopes. So that's the reason these are called as occupational infections among staffs. Healthcare associated these infections will be exogenous and endogenous and iatrogenic. These are 3 type of nosocomial infections. What we occur in generally in healthcare associated infections.
ఓకే. సో ఆస్పెక్టింగ్ టెక్నిక్స్ గురించి చెప్పండి.
Asepsis ante it is to prevent any septic techniques andi. So anything like which is causing microorganisms or spreading microorganisms ni control cheyadaniki manam aseptic techniques use chestam. So in this if you see common healthcare associated infections vachesesi urinary tract infection gaani, surgical traumatic wound infections gaani, respiratory tract, bloodstream tract, ilanti infections common ga untayi. So anything, any procedure, any like this one will cause the modes of transmission like direct contact ఉండొచ్చు, droplet ఉండొచ్చు, airborne ఉండొచ్చు, లేదా vehicles ఉండొచ్చు, vectors ఉండొచ్చు. Any type of things we can lead to infections. So chain of infection చూస్తే pathogen is the first thing అండి. So తర్వాత if you see from the pathogen it will start to the reservoir. So it will stay, reservoir means it will stay for some long for the development of that. Then portal of exit antam, how it access into the which type of organ. And then if you see it will go for mode of transmission through that either to cough gaani, droplet infection gaani, to the food gaani. So మనం చెప్పుకున్నట్టు ఇందాక ముందున్న వెక్టర్స్ కానీ దేని ద్వారా అయినా ఇట్ కెన్ ట్రాన్స్మిట్ టు ద పోర్టల్ ఆఫ్ ఎంట్రీ ఇన్ టు ద బాడీ. మన బాడీలోకి ఎలా ఎంటర్ అవుతుంది, ఎప్పుడైనా సరే ఓపెనింగ్ ఉన్నప్పుడు, కట్ కానీ వూండ్ కానీ ఏదైనా టైప్ ఉన్నప్పుడు ఈజీగా ఎంటర్ అవ్వడానికి అవకాశం ఉంటుంది. సో వీ షుడ్ బి వెరీ కేర్ఫుల్ అండ్ వూండ్ కేర్. సో ససెప్టబుల్ host it will find out ekkada it can go through the microorganism, it will find out, and then it will start developing, and further it will lead to complete process of infection it will cause to the patient. So ikkada infection control lo mana main thing endante, so it will be help out in preventing the spread of infection from one person to other person. So it should not spread. So that's the reason we have to use a standard precautions for any aseptic technique or something. Like aseptic techniques lo vachesi standard precautions lo every patient care kani, during exposure to any potential infected material kani, body fluids kani, as blood to others kani. So this will commonly have this one. So these are the basic common procedures what we will do in hospital. Components will be either hand washing anedi common aseptic process, barrier precautions antam another process, and then is sharp disposable antam, that is another one, and then handling of the contaminated material in the hospital is again one. So these are the thing, and the first basic principle to prevent infection is at least 35 to 50% of all the healthcare associated infections are associated with only 5% is with patient care practices. So using of care of urinary catheters కానీ, vascular lines కానీ, IV lines అంటాం అదైనా కానీ, therapy and support of the pulmonary functions like pulmonary dysfunctional ఏమైనా ఉన్నప్పుడు, surgical procedures చేసేటప్పుడు కానీ, hand hygiene and hand standard precautions. These are the basic first principle of infection prevention which have to be used in this. Whereas healthcare associated urinary tract infection lo chuste manam each disease if you go some of the basic things which are affecting in the hospital and which are important for the patient care. So these are UTI is very common and it is 40% of hospital acquired infections. Most of these infections due to urinary catheters. So female or male urinary catheters when we keep, so there is a chance of getting infection in that region. So 25% of inpatients are catheterized when they are into the hospital admission, and which will lead to increased morbidity and cost also. That means they will have more disease rates than the normal what disease they are having. So interventions చూస్తే మనం దీంట్లో they should know, as a nurses they should know the familiar things like isolation precautions is very important. And isolation precautions if you see hyperthermia interventions అంటాము, which eliminate underlying cause and fever management and health teaching or health education to the patient, how they have to maintain antibiotic therapy, what time should be maintained as medicine administration మన ఫస్ట్ fundamentals లో చెప్పుకున్నట్టు. తర్వాత psychosocial support we call it as, and those things also very important because patient will be having lot of doubts, tension and stress related to disease because it is new for them and they know whether they don't know how they can come back to the home. So psychosocial support is very important for each individual who are admitted into the hospital. And healthcare resources also, what we have been provided in the hospital should be maintained with clean and sterilized ones should be maintained. So this is another intervention, and if you see the manuals which are maintaining standard techniques for this isolation precautions from OSHA and CDC guidelines, what we follow is contact, droplet and airborne. So these three things, personal protective equipment antamu. So in this personal protective equipment, if you see gowns, respiratory mask, what we use regularly, eye protection, and gowns and gloves, and specimen collection when they are doing, and bagging, trash and linen okati, transporting the patient from one place to another, one ward to another ward, or one place to another place. It's very, very important. These PPE are very, very important. That is called as personal protective equipments. So basic procedure what we have to do, anyone is important, is first thing is hand washing, Andy. So here proper hand washing is the most important, which will prevent and reduce the infections. So if you wash and rinse hands for 15 seconds using a dry paper towel to turn offset, and alcohol based hand wash also is there nowadays, we are using to cleanse it. There is a steps of hand washing actually. Hand should be, there is a protocol for hand washing which is called as hand wash should be washed only certain time or not, it is not like that. Before or after, any time to the patient contact, when you are going to that, you need to wash hands, because infections can be transmitted from the patient to the medical team members also, and even if the person is having, it can transmit to the patient also. So it is two-way to be careful. And before putting on gloves and after taking them off, we have to wash our hands, because there is a lot of other materials which are used to conserve the gloves. And after touching blood and body substances or any contaminated patient care equipment during procedure like IV canalization antamu, lekapothe any NG tube antam, nasogastric tube intubation antamu, or even if you wear gloves or if you remove it, we have to wash again. And between different procedures on the same patient, different procedure oka same patient mein chesetappudu kuda we have to change and we have to wash again, and that is a basic thing. In general, in hand washing, if you see, hand washing is the single most effective precaution for prevention of infection and transmission between patients and staff. So it is easy, and it is a very thing with what is there in our hand, but most of them are negligent in doing in hand washing before anything. So hand washing with a plain soap with a mechanical removal of soil and trances bacteria, it is 10 to 15 seconds. If you do properly, then it will clear it. And this aseptic technique, which will remove and destroy the bacteria a lot, and antimicrobial soap or alcohol based hand rub for 60 seconds at least will help out to control the infection in the patient. And this one, so methods of hand washing untundani, surgical hand scrub antam, one thing, that is removal or destruction of transit flora. ఎప్పుడైనా సర్జరీకి వెళ్ళే ముందు, సర్జరీకి అటెండ్ అయ్యే ముందు, సర్జరీ చేసే ముందు, దిస్ టైప్ ఆఫ్ సర్జికల్ హ్యాండ్ స్క్రబ్ ఇస్ డన్. ఇట్ ఈస్ అట్లీస్ట్ 2 to 3 minutes చేయాలి. సో దట్ ఈస్ టు యాంటీ బ్యాక్టీరియల్ సోప్ అంటాం, ఐదర్ వి కాల్ ఇట్ యాజ్ బెటడిన్ స్క్రబ్ అంటాము. ఈ రెండితో చేయొచ్చు, అది వీ హ్యావ్ ఎ టెక్నిక్, అండ్ దట్ ఈస్, and our hands and fingers also are the best friends for us, which we have to believe, and even we teach our generations also with us. And this way simple hand washing is also very important, clean hand washing before and after taking care anything we have to do. And like we should have all this equipment like sinks and soap and water, the things, and all the doctors, nurses must compel to do hand washing policy, and standards should be followed. So when they follow the standards only, it will affect. So the next one will become ours. So this is type of hand washing.
Okay. So PPE గురించి చెప్పండి.
Yeah, personal protective measures ఉంటాయి కదండి. Personal protective equipments are used in the hospital as well as in the wards and surgical. So anywhere like gowning technique అంటాము, gloving technique అంటాము, తర్వాత wearing of mask కానీ, and these are very, very important. And sterile technique to use, how regularly we use sterile technique in taking care of the patient is also very important for us. So these type of all the things which is called as, these are called personal protective equipments. So how to wear gloves, which type of gloves we have to wear, and which type of how is the technique of wearing gloves, how we have to wear a gown, and how is a surgical hand scrub method, and how we have to do it normal cleansing of method. And these are very, very important techniques. And how to wear a mask. Okay, mask wearing and removal of the mask, and this one. So this is also very important in this. And footwear to be worn, and these are very commonest things which we have to know and we should educate. So whenever we are needing, and footwear is also very important. And any wound care we will tell, as we said in the fundamentals, wound care is very, very important for us to take care of the wound, so that there is a transmit of microorganisms into the body. So these are all basic personal protective measures which we have, equipments which have to use in the hospital. So in generally it is helping out in preventing the infection and control. So these are the basic things which will be there in this one. And another one is biomedical waste management antamandi. So when we are doing the biomedical waste management anedi, to throw out the waste in a through a proper channel. So in every hospital right now we are maintaining this biomedical waste management. Their color codings will be given, so red, yellow, black, and sharp instruments give white. So we will know which things, human body waste, in what we have to throw, and which type of other materials which are used for the procedures which we need to do, or sharp needles or something, how we have to dispose it by burning it, incinerating, and single usage of syringes and all, catheters, cannulas. These all things are called using of biomedical waste management. So basically a nurse role comes in complete in microbiology. Why exactly they have to read microbiology? Why exactly they should know all these things? Why, how many millimeters, how many nanometers, why they have to know? Yeah. What is the necessity for nurses to keep into their syllabus in detail? Is because basic thing is they should understand what is microbiology, okay, what are the microorganisms, which is causing to which agent and which disease. This knowledge a nurse should have. When she has this knowledge, automatically she will also utilize in taking care of this preventing and controlling of the nosocomial infections which are occurring in the hospital, barrier nursing techniques we will call it, those things, and biomedical waste management. This is very commonly we have to follow in that. So in this also, if you see, isolation is also another technique. As I said in previous classes, isolation is there and to prevent infection from crossing one person to other. We keep in a separate way of taking care of the patient and his equipments or her equipments. Completely her area will be there, so that she can reduce the infection fast and can be recovered back. So basic complete microbiology is based on that. So PPE also.
రైట్. సో ఈ ఎగ్జామ్కి సంబంధించి గురుకుల్ విద్యార్థులు చాలా మంది ప్రిపేర్ అవుతూ ఉన్నారు. సో వాళ్ళు ఏ విధంగా ప్రిపేర్ అవ్వాలి, ఏదైనా ఇంపార్టెంట్ సిలబస్ బేసిక్గా గుర్తుపెట్టుకోవాల్సింది ఉందా, ఒకసారి వాళ్ళకి సజెస్ట్ చేయండి.
షూర్. సో మన మామూలుగా చూసుకున్నట్టయితే లైక్ బేసిక్గా మైక్రోబయాలజీ విచ్ యూ హ్యావ్ టు రిమెంబర్ వెల్ ఈజ్ అబౌట్ ఇన్ఫెక్షన్ కంట్రోల్ ప్రాసెస్ అండి, యాజ్ ఏ people who are appearing for the examinations. So what is infection and infection control methods అనేది చాలా ఇంపార్టెంట్. అందులో how the infection agents are causing, what are the signs and symptoms అనేవి కూడా చాలా ఇంపార్టెంట్. So these things will be occurring like body producing infections అంటాం, like symptoms and the signs, swelling, redness, ఇలాంటి very important things. These things they have to identify. And which is called as increase in vital signs. Vital signs, any differentiation is there, which type of infection is very commonly affecting. Adi raise in temperature, pulse rate, lekapothe any type of blood pressure also is increasing or decreasing, hypertension or hypotension antamo. So these what are the local things, main things we have to identify. Pain, different types of pain ela undi, swelling ela undi, identify cheyali first. So that they have to identify. So you should know in a medical terminology what it is. And blood examination lo chesi leukocytosis antamu, that is also they have to identify. So by identifying these things, they will know which type of things are, they may assume it, but they may not diagnose. But once they have culture or something they have done, then automatically it will help out in taking care of the patient. So this is the one point where you have to keep an idea about infection. What is infection, how it is causing, what is the risk of infection, in which is very important, like admission to the hospital nunchi community acquired infection, a infection anedi important. So acquired infection lekapothe it is when you admission to the hospital it is occurring, or to the community based anedi chaala important. Or in the hospital infections unnaya, what is nosocomial infections anedi chaala important. So ee nosocomial infections nunchi the controlling, because 24/7 is the nurse who is taking care of the patient, so that she should have the way how to control this nosocomial infection. So it is basic on the admission nunchi, patient admission unnapadu nunchi, when they are going back from the hospital and when they are in the at home, whether they are acquired with any infections or not, giving health education is very, very important. So when to give an health education, a nurse should have complete overall idea about what is microorganisms, how they will transmit from one person to another person, and she should educate them wound care or anything, any openings, any cut, anything is there due to the procedure to control their disease. This also she should explain. So this is very important part during the examination also is infection control. So that is healthcare associated infections, exogenous kani, endogenous and nitrogenic, these type of infections, anything is there, we have to identify and you have to specify it what type of infection it is. So indulo kuda if they read it how is these nosocomial infections are affected, so they can easily answer to the questions which are be given for the choose the correct answers for the infection control and all. So other than this, if you just say common associated infections untai, how is the modes of transmission untundi, which disease is transmitted through which antam. For example, like any respiratory disorders unnai ankondi, cold, flu antamu, ivanni ela vastunnai ani adigaru anukunna question, and they will give a like choices like droplet gaani, airborne gaani, vehicles vectors antamu, and they can give a causes the contact with direct and indirect contact. So the right answer you have to put it in this. So you should know which infection is leading to this. Suppose in another like any malaria, typhoid gani, cholera or any other type of med-surgical problems are there. Even microbiology is induced into all the med-surgical disorders. So those also modes of transmission అనేది చాలా ఇంపార్టెంట్. ఈ త్రూలో కూడా వాళ్ళకి క్వశ్చన్స్ అడిగే అవకాశం ఉంటుంది. సో దట్ ఈస్ అనదర్ పాయింట్. చైన్ ఆఫ్ ఇన్ఫెక్షన్ మనం చెప్పుకున్నట్టు అదొకటి. సో హౌ ఇట్ ఈస్ అక్కరింగ్ అనేది ఈచ్ రీజన్ లో హౌ ఇట్ ఈస్ ఎగ్జాక్ట్లీ అక్కరింగ్ అనేది కూడా ఇంపార్టెంట్. ఇందులో కూడా ఎవ్రీ డిసీజ్ ఆల్సో ఈస్ హ్యావింగ్ దిస్ టైప్ ఆఫ్ కండిషన్. సో దే షుడ్ రీడ్ in a pathogen, reservoir and portal of exit, mode of transmission, ఎలా ఎంట్రీ అవుతుంది, ఎలా ససెప్టబుల్ హాస్ట్ లో ఉంటుంది, how which type of pathogen is occurring and which type of pathogen is occurring and how the infection is right. So each disease condition is crossing to this chain of infection, so that they have to identify, so that they have to read and specify it, because they may ask any type of question which is related to the diseases. So and in infection control, if they see, they have to maintain lot of things which in that infection control they has a barrier nursing techniques antamu. Barrier nursing techniques lo nurses role is very, very important. She is in between. Barrier means she is in between the both to get in to prevent infection and to get infection also she is only in the between, and even all the medical team members. So as we said, infection control lo hand washing e kakunda PPE, that is personal protective equipments to use, and hand washing techniques, and each procedure wise to use proper aseptic techniques to any procedure, like any injection to be given or any IV cannula be to kept, or if you have to keep any nasogastric tube according to the procedure, if they follow the equipments and sterile equipments, there is a 80% of chance is reduced in the infection control. So infection can be controlled by using a proper personal equipments and by using a proper barrier techniques for nurses, so that even they can also prevent from themselves. So which is very common, which is very important, and they should identify which type of this. So in infection control, another one is biomedical waste management also. They have to keep in very important point in that, so that in that also the questions can be come and this, and codes should be kept in mind, and codes should be identified properly, and which type of agents should be thrown in what. So this is also very important in this one. And if you see standard precautions, we have to keep very commonly. So standard precautions, we should keep a standard means it is standard. So when it is kept and written after giving a research or doing a research that needs to be done, we should not we should not mislead it. So through that what happens is it will be infectant to the patient and even to the material. So there are a lot of ethical and legal cases which are mainly occurred only through the infections. So suppose if you see, there is a two chances of things. One is HIV patient will be there. So we have to use a separate equipment because it is easily transmitted through the blood transfusion. So the affected needles or any body fluids or any type of those things should not be used with the same things to another patient. So where this will start, you are spreading the infection than controlling the infection. So infection should be controlled based on the patient condition. So very important is two components is like there can be hand washing techniques and barrier precautions, sharp disposables, and handling the contaminated materials. So this is another important thing andi, contaminated materials how to dispose antam. So any through swabbing gaani, culture gaani, లేదా urine specimen culture antamu, general blood examination antamu, లేకపోతే any type of removal of like pus gaani, లేకపోతే any type of materials which are be then how to dispose this, which is contaminated, which is easy transmitted to another patient. So or for yourself also, medical team members should know how to handle that contaminated material, how well you have to use it, how to collect it, and how to dispatch it. So these things they should know very carefully, because it should not be spilled and spoiled. So where microorganisms can grow back and it can be spoiled. So this type of infection control is they should know, and principles of infection prevention also they should know, and lot of isolation precautions. This also they can ask in standard precautions for isolation precautions, what we call it as like hyperthermia intervention antamu, and increased temperature, raise in temperature. Infection anangale, why you will call this raise in temperature? This is a common signs and symptom which can be seen very fast. Okay, when it is a raise in temperature, we can estimate that they are under some infection process. Which it is we have to identify by through proper cause. What is underlying cause అనేది మనం add చేయాలి. So then which type of fever అనేది? Fevers are also lot of different fevers are there, which different type of bacteria or fungi, viral it can affect. So that how to manage, and like health teaching how to give, what type of the things you will give, what is the basic important one అని అడగొచ్చు. ఈ కండిషన్ లో ఈ ఇంపార్టెంట్ లో ఇన్ను పేషెంట్ కి ఏ హెల్త్ టీచింగ్ ఇవ్వచ్చు అని సడన్ గా అడిగినా ఇన్ క్రాస్ క్వశ్చన్ యూ హ్యావ్ టు బి రెడీ టు ఐడెంటిఫై. యాంటీబయాటిక్ థెరపీస్ అంటాం, విచ్ టైప్ ఆఫ్ యాంటీబయాటిక్ ఈజ్ యూస్డ్ ఫర్ వాట్ టైప్ ఆఫ్ డిసీజ్ అని కూడా అడగొచ్చు. విచ్ ఆర్గానిజం ఈస్ ఎఫెక్టింగ్ టు విచ్ డిసీజ్ అని అడగొచ్చు. సో విచ్ ఈజ్ ఇట్ ఈస్ ఎ గ్రామ్ పాజిటివ్ బ్యాక్టీరియానా గ్రామ్ నెగటివ్ బ్యాక్టీరియానా అని కూడా అడగవచ్చు. సో యాసిడ్ ఫాస్ట్ బ్యాసిల్ అయితే మనం కనుగొచ్చా లేదా అని కూడా అడగవచ్చు. సో దర్ ఇస్ ది క్వశ్చన్స్ ఆర్ నాట్ డైరెక్ట్ క్వశ్చన్స్, దే ఆర్ ఇండైరెక్ట్ క్వశ్చన్స్. సో దట్స్ వై దే ఆర్ జడ్జింగ్ ద థరో నాలెడ్జ్ ఉందా లేదా, whether they are purely eligible or not అనేది చేస్తున్నారు. సో that is very important. And psychosocial support, socially and psychologically how to give us support, and healthcare resources. So what are the resources are present in the hospital for certain thing, what is important to dispose. There, for each condition there are little different type of standard precautions to be used for giving the care to the patient for the healthcare resources. So we need not to keep all the equipments for all the patients. Which type of patient, that's the way nowadays in hospitals they are divided into wards and all. So each ward can be equipped with separate things. So that is the way the role in this. So this is also very important precautions which they can understand. So and basic manuals untai to identify the CDC and OSHA, to identify which type of precautions we have to take anedi we need to follow that, and that guidelines also you should keep to have in it. Ee way lo kuda question adagocchu. And like what are the personal protective equipments lo gowns, respiratory masks, eye protection goggles antamu, gloves antamu. Specimen collection kuda separate how which color what it is, like blue is for CVPR, ash color, red color cap, what type of preservative is added in that to save which blood. So this all things they should have an idea. And bagging and trash and linen and how to transport from patient one person. This is very very important topic in the microbiology, that is personal protective equipment. And they should also identify exactly what type of things we have to use in what. And then biomedical waste management, these things they have to keep in mind so that they can answer well to the questions. So if they practice well, they will do it in a perfect way. So the practice makes man perfect. So if they practice well in during time of their service, surely they will attend these questions of microbiology, I feel.
Okay. సో మైక్రో ఆర్గానిజం గురించి, మైక్రోబయాలజీ గురించి, అలాగే ఏ సర్జరీకి ఎలాంటి మాస్క్ వేసుకోవాలి, ఏ విధంగా ప్రొటెక్ట్ చేసుకోవాలి మనల్ని మనం, ఇన్ఫెక్షన్ ఒకరి నుంచి మరొకరికి రాకుండా ఎలాంటి క్లీన్లీనెస్ పాటించాలి, ఈ విషయాలన్నింటి గురించి కూడా వ్యూవర్స్కి చాలా చక్కగా ఎక్స్ప్లెయిన్ చేశారు. థ్యాంక్ యూ సో మచ్. నమస్తే. ఇది ఇవాళ టీసాట్ స్పెషల్ లైవ్ షో. కీప్ వాచింగ్ టీసాట్.